Okay guys, today we're going to cover the first section of the head anatomy. You'll notice that it's chapter 7. I hope you guys have taken the time to read chapter 7. I just finished reading through it. It's pretty straightforward, and with anatomy is a lot of memorization. There's just nothing you can do about it. You have to sit down, take the time to memorize these different structures. I can't put that information in your head. I can repeat it, reiterate it, talk about it, but ultimately it's up to you guys to sit down and memorize these structures. And the head, although it's a pretty small portion of the body, it actually has a lot of detail, and we can go into a lot of detail about the different structures, and I think we will. I'll try to keep it as simple as I can do it, but when it comes to something so incredibly complex as the skull and the brain, the head, it's going to take time on your part to sit down and really just spend time with it and internalize it. So today, this little mini lecture that I'm going to give here is about the skull. So we'll go through it. Just overview of the head. So when we talk about the head, we're talking about the skull and cranium, which is what we're going to cover here in this mini lecture. And then there's a whole bunch of other structures and things that we can focus on, and we will focus on. The face and scalp, the meninges, the brain, the cranial nerves, which we will spend quite a bit of time on, the eyes, parotid regions, oral, nasal, and ear. So basically anything to do with the face or head, we're going to cover it. When we go into your instructional objectives, these are listed on your syllabus, and actually in your syllabus they are paired up with those of the neck. So I separated them out and I just put them down on here. It doesn't seem like there's very many of them, but each one of these kind of encompasses a lot of information. I mean, if you just took one, for instance, this one, identify the face and scalp, muscles, nerves, arterial, and venous supply. That's a lot of information. So you really just need to sit down and make sure that you know that you could answer all of the components in each of these objectives, because they're all testable material. Here's some more instructional objectives. These are just taken from your syllabus. And then the last bit of instructional objectives for the head. Let's get into the organization of this lecture specifically. I'm trying to keep these integrity lectures to the section of the head because there's just so much. And so this one we're going to stay focused on the skull and cranium, which is kind of the external portions of this. And we'll go through the different views, or the anterior, the lateral, posterior, superior, and inferior views, as well as the cranial cavity. We look at the roof and the floor, and that's how we're going to break up this lecture here. So let's get into it. When we look at the head it's small, but it's very complex. So try to simplify the different regions and compartments of the head. I like this little diagram because I like simple. And here we have the cranial cavity, which houses the brain. It's the largest compartment. It contains the brain and the meninges. We'll cover this cranial cavity in here a little bit later when we talk about the brain and meninges, but today we're covering the skull itself. Most of the other apparatuses are paired, so we have the orbits, we have the ears, we have the orbits that contain the eyes. They're cone-shaped chambers, and immediately inferior to the anterior aspect of the cranial cavity. They're directed posterior medially, and that's where the nerves go through. The walls of the orbits of the bone are bone, whereas the base of each conical chamber can be opened and closed by the eyelids. So we think about the eyelids here. This way of the cone can be opened and closed. We also have the nasal cavities, the upper parts of the respiratory tract. They're located between the orbits. They have walls, floors, ceilings, which are predominantly composed of bone and then also cartilage. The anterior openings to the nasal cavities are called the nares, or the nostrils. The posterior openings are the choanae, which are the posterior nasal apertures, which are these back in here. The continuous with the nasal cavities are air-filled extensions or paranasal sinuses, which can project laterally, superior, posteriorly, and the surrounding bones. The largest sinus is the maxillary sinus, and they're inferior to the orbits. So right in here. And then we have the oral cavity. Pretty simple, it's their mouth. It's inferior to the nasal cavities, separated by the hard and soft palates in here. The floor of the oral cavity is formed entirely by soft tissues, all of this in here. The anterior opening is the oral fissure, which is where your lips are, into the mouth, and the posterior is the opening into the oropharyngeal isthmus, which is back here. Other regions that are not included in these compartments, but there are other important regions of the head, are the face and the scalp, which are kind of a no-brainer, no pun intended, but the face is here, the scalp is here, and we'll cover those separately. So next we're going to cover the skull. That's basically what this lecture is going to be about. Kind of dividing it up into different sections, giving you kind of the overview of the different structures that we want to be familiar with in relation to the skull. Now, if you've been looking at this picture, either you see a skull because it says skull right here, or you might see two little girls with their puppy dog. I thought that was a cool picture, kind of get us rolling into the skull. So, the skull or the cranium can be divided multiple different ways, but initially what way we can think about it is the two parts of it, which are the neurocranium, which is the bony case of the brain, the calvaria in the cranial base, which you can see them divided up here, this is the neurocranium. As you can tell from the name of it, neuro meaning brain, this is the area that houses the brain. Then we can talk about the viscerocranium, which is the other portion of the skull. This is known as the facial skeleton. When we talk about the different bones in this area, we know there's the three singular bones, the mandible, the ethmoid, and the vomer, and then we also have the six pairs of bones, which are the maxilla, inferior nasal concha, zygomatic bone, palatine, nasal, and lacrimal bones. And when you look at this figure here, there's a lot of different structures that you need to know. All of this is easily testable material, and it's really just a matter of sitting down and teaching your brain to remember what these things are called. There's a lot of different things that you have to name, and really it's just going to take time. I don't want to sit here and read them off to you because I don't think that's going to do you any good. Just kind of try to give you the overview of what's important, what to look for. So this is just kind of a basic overview. So next we'll go into the anterior view. So when we're talking about the anterior view of the skull, we're talking about what we can see when you look at someone's skull straight on. And there's several structures that we'll highlight here. Now obviously all of these are fair game. We do need to know all of these different structures. And hopefully if you've been paying attention in anatomy lab and going through your osteology, you already pretty much know these. The skull has 22 bones, excluding the ossicles of the ear. Except for the mandible, which forms the lower jaw, the bones of the skull are all attached to each other by sutures, are immobile, and they form the cranium. So when we think about the cranium, it can be subdivided into the calvaria, the base, and the facial skeleton. The upper domed portion, which is the calvaria, kind of up in here, covers the cranial cavity containing the brain. We already know that. Then you have the base, which is the floor of the cranial cavity, which we'll go into more detail in. And have the anterior portion, which is the lower portion, which is the facial skeleton. And then the mandible, which is not really part of the cranium or part of the facial skeleton, but we can kind of include it in the viscerocranium. The anterior view also includes the forehead up here, which is comprised of the frontal bone. Inferiorly, we have the orbits and the nasal region, as well as the upper and lower jaws. Anterior view is prominent for showing all these bones. You got the frontal bone, the zygomatic bone. We have the nasal bones, the maxilla, and the mandible. And so also when we're ever looking at a picture of a skull, we also want to take note of the different foramen that we see. So if we see this right here, anytime you see a foramen, you need to know what it's called and you need to know what goes through it, because all foramen are they're special for something, so we need to know those things. This is the supraorbital notch or foramen, and what travels through there? Well, it's the supraorbital nerve and vessels. Makes it easy. Then we go into the infraorbital foramen, and what goes through there? Well, the same thing, infraorbital nerve and vessels. And then we come down to the mental foramen, which are here bilaterally, and the mental nerve and vessels go through that. Anytime we think of the word mental, we're not talking about crazy here, we're talking about the chin area. If you can imagine the thinking man with his hand on his chin, just really thinking about something really intensely, you can think he's holding his hand to his mental protuberance. He's thinking, he's using his mental to think about what's going on. So again, mental is the chin area. And also we can see here that there's a glabella, which is located right in the frontal bone area. It's located between the two superciliary arches, right here and here, and it can be thought of as kind of like the third eye of the skull. Now, superciliary arches are more pronounced in men than women most of the time. Also clearly visible in the frontal area, we have the supraorbital foramen, which we kind of talked about, and then we have medially the superciliary arches that go into the medial portion of the orbit. Let's see, we also have the zygomatic and nasal bones in this area. So we talked about the zygomatic, we talked about the nasal bones, the lower rim of the orbit, as well as the lateral and inferior rim of the orbit is formed by the zygomatic bone. So you'll see in here, zygomatic bone. The center of the frontal nasal suture is formed by the articulation between the nasal bones and the frontal bone, and that's called the nasion, which is right in here. And we'll go through all the special convergence points on another slide. Then we can go into the maxilla. The maxilla is part of the face between the orbit and the upper teeth, and it's formed by paired maxillae. The superiorly, it makes the inferior and medial rims of the orbit, so you can see right in here. Laterally, zygomatic process of each of the maxilla articulates with the zygomatic bone. You'll see right here, there's the articulation. Medially, the frontal process of each maxilla articulates with the frontal bone, right in here. And inferiorly, each maxilla ends at the alveolar process, which are right in here, which house the teeth in the upper jaw. So we go down into the mandible. It's the jaw, it's this big bone right here. It's a ring-like structure. The different pieces of the jaw we'll learn separately, but basically you have the body, you have the ramus, which is through here, and they meet to make the angle of the mandible, which is right in here. The body of the mandible has two parts. The lower part is the base of the mandible, right here. And then you also have the alveolar part of the mandible, which is alveolar, always kind of means in this area related to the teeth. And then we already talked about the mental foramen. So that's the overview of the anterior portion of the skull. There's many other parts to this that I didn't mention in detail. Just make sure that you know them well. So going over to the lateral view of the skull, we can see some different structures, see some different pieces of the skull as we look. The bones of importance laterally, we're talking about the frontal bone again, parietal, occipital, the sphenoid, the temporal bones, and in the facial skeleton we can see the nasal bones, the maxilla, the zygomatic bone, and the mandible. So when we look at the lateral view of the skull, We look at, like I said, portions of the calvaria, portions of the facial skeleton, and half of the lower jaw. These bones, we already talked about the different ones, the frontal, parietal, occipital, sphenoid, and temporal bones. When we go into the different ones, we have lots of different junctions or sutures in these areas that we need to be familiar with. The upper regions, the frontal bone articulates with the parietal bone at the coronal suture. Think of a tiara or crown sitting right on top of there. Then the parietal bone articulates with the occipital bone at the lambdoid suture. And we call it lambdoid because it is L-shaped, or at least the Greek letter L-shaped back here. We go into the lower parts of the calvaria. Frontal bone articulates with the greater wing of the sphenoid, and then articulates with the parietal bone at the sphenoparietal suture. Right here, sphenoparietal suture. Right here. And then we can go into the anterior edge of the temporal bone being the sphenosquamous suture, which is right here. So there's a lot of different sutures. You need to know all of them and what they connect. Then when we look at the junction right here, this little outlined circle, where the frontal, the parietal, the sphenoid, and temporal bones, and that's called the pterion. Okay, the pterion, we talked about it in lab. For those of you who haven't gone through your clinical correlations in lab, this is a super important part of the skull for multiple reasons. We can think of it as the convergence point for a lot of the different sutures. So because of that, or maybe in spite of that, or however it is the thinnest portion of the skull. And what that does is it makes it very prone to injury, and catastrophic injury when we think about it. The potential for serious injury in this area, the clinical consequences of a fracture here can be very serious. Like I said, it's particularly thin, and just on the other side of the skull from here we have the middle meningeal artery on the other side of here. And so if we suffer a fracture to this area, a depressed skull fracture, it can result in a bleed or a tearing of that middle meningeal artery just behind it, which can cause a pretty significant epidural hematoma, and those can be very fatal. So this is a very important part to know clinically, as well as it just kind of connects all the different pieces here. A way we can think about the artery that would get severed is if you think about an MMA fighter getting punched in the temporal region here during an MMA fight. You might think that if this pterion area is fractured because of that blow to the head, that you might suffer a tearing or damage to the MMA, middle meningeal artery, on the other side of the pterion. So that's very important clinically. There's more about that in other slides that we will go through, but for now that's kind of the gist of the importance of the pterion. The final articulation in the lower part of the calvaria is between the temporal bone and the occipital bone, which is the occipitomastoid suture. Here's the mastoid process, and so that's this suture back here. When we look at the temporal bone, there's different parts of the temporal bone. There's the squamous part, which is this large flat plate. It forms the anterior and superior parts of the temporal bone and contributes to the lateral wall of the cranium. So it's a pretty big portion right in here. It articulates anteriorly with the greater wing of the sphenoid. We already talked about that. And with the parietal bone superiorly at the squamous suture right in here. We also have the zygomatic process in here of the temporal bone, which is anteriorly bony projection on the lower surface of the squamous part of the temporal bone. Initially projects laterally and then curves anteriorly to articulate with the zygomatic bone. Then in that together, those two form the zygomatic arch. Immediately below the area of the zygomatic process from the squamous part of the temporal bone is the tympanic part of the temporal bone. So right in here. And that is particularly important because it is where the external acoustic meatus is located, and it's where the external acoustic opening is, and where we think about the ears are located. Then we have the mastoid part, which is most posterior part of the temporal bone, and it's the only part of the pteromastoid part of the temporal bone seen on the lateral view of the skull. So right here. It's continuous with the squamous part of the temporal bone anteriorly. It articulates with the parietal bone superiorly and the parietal mastoid suture, right? The occipital bone, and it articulates with the occipital bone posteriorly. These two sutures, the parietal mastoid and the occipitomastoid sutures, are continuous with each other back here. Let's see. So then we can go into the visible part of the facial skeleton from the lateral view. We have the nasal bone anteriorly, the maxilla here, the zygomatic bone in here, and then the mandible, which is the lower part of the jaw. You can see half of it here, and then superior part of the ramus. There's also the condylar or the coronoid process. Condylar process, which is up in here, which leads to the articulation point of the mandible, and then the coronoid process, which is the point of attachment for the temporalis muscle. So we have the condylar process and the coronoid process. Let's move on. So next up we have the posterior view. On this view, the bones we can see most clearly are the occipital, the parietal, and we can still see part of the temporal bones. There's not as much going on posteriorly as there is anteriorly or laterally, but still important to note these different things. On the occipital bone, we have the squamous part of the occipital bone right in here, which is the main structure of this view of the skull. It articulates superiorly with the paraparietal bones at the lambdoid suture. And laterally with each temporal bone with the occipitomastoid sutures. And then also along the lambdoid suture, there are these small islands of bone called the sutural bones, and they may be observed in this area as well. There's a few bony landmarks we want to take note of on the occipital bone. We have the midline projection, which is the external occipital protuberance, which is right in here, which you can see right in this area. And if you feel on the back of your head, you can feel that landmark. And then you also have the superior nuchal lines, right? And which are right here, superior nuchal lines. And you have the inferior nuchal lines. And then also extending downward from the external occipital protuberance, you have the external occipital crest, which is right in here. Alright, when we look at the temporal bones, we can see, again, we already kind of talked about them, but lateral, you can see them in the posterior portion of the skull, mostly the mastoid process, which is a prominent feature you can see posteriorly. And then you also have the mastoid notch right in here, which is a little notch right here. You have the process and the notch, and the mastoid notch is the point for attachment of the posterior belly of the digastric muscle, which we'll go into when we talk about the muscles in the head and face area. So that's pretty much it for the posterior view. There's not a whole lot going on there. When we look at the superior view of the skull, we have the frontal bone here, parietal bones again, and occipital bones. Another thing that we can see here is the sutures. So we can see the coronal suture here as it meets with the sagittal suture, and that little area here is called the bregma here. And then also back here we have the lambda, which is the meeting point of the sagittal suture and the lambdoid suture, which is the lambda, or the Greek letter L. So also we see these little parietal foramen right here. Hopefully you all were able to notice this on your clients in the lab, because that is important for where the emissary veins can pop through from the inside of the calvarium to the outside. And as we talked about in the lab, this can be a potential area for infection to spread. We'll go through that when we get to the scalp. So here's another slide that just kind of demonstrates the different sutures and the different meeting points or convergence points for all of these sutures. Again, we kind of already went through all of these. I'm not going to go through them specifically again, but you have all the different sutures and you have their meeting points here. When we're looking at the way that the skull forms, we talk about the fetus or the newborn. They have these large fontanelles, or areas where the sutures haven't merged together yet, and this is to allow for growth within the first few years of life. Within the first year of life, the fontanelles will remain open. Full ossification of these fontanelles will take place, normally completed within the late 20s. The full ossification, and then normally it's completed ossification by the 5th decade of life. So in the first year you're going to see a lot of changes. These are going to close up, and then all throughout your life, as your skull grows to meet the need of growth by the brain, etc., you'll see that it completely ossifies much later in life. Let's see. Also in infants, you'll see a lot more laxity or mobility to the skull itself. Let's see. There are 3 pairs of synovial joints on each side of the head. The largest are the temporomandibular joints and the temporal bone, as it connects the mandible with the temporal bone here. The other 2 synovial joints are between 3 tiny bones in the middle ear, which are the malleus, the incus, and the stapes. So we'll get to that later when we talk about the ears. Just thought it was interesting to note that. In your book, they have this nice figure laying out the different meeting points for the sutures and what they're named. And I thought it was fun to remember them these ways, remembering what they mean, and then kind of tying them together with how they are located on the skull and how they look. So again, I'm not going to read through these. You can read through it. It's also in your book. But I think these are pretty important areas. Also, when we were talking about the anterior fontanelle, we noticed that it becomes the bregma, and the posterior fontanelle becomes the lambda once they converge together. Alright, so I think for me, the inferior view of the skull is kind of the most complicated, because it's the part that we don't see all the time with our eyes when we look at somebody's face. And there's a lot of different foramen, there's a lot of different little openings and structures and things that we need to be familiar with. We really just have to sit down and memorize this slide, or memorize this figure in your book, because there's just so much going on. It's really hard for me to go through all of it, but I can go through a little bit of it. So another good thing you can do is use this to study where the cranial nerves come out, because it's kind of important as well. And like I said, anytime you see a canal or foramen, you need to know what goes through it, because it's important to know. When we look at the base of the skull, or the bottom of the skull, we can see that it's divided up into the different areas. Again, the occipital, the temporal, sphenoid, and then the maxilla right in here. This is also known as the anterior part, which includes the teeth and the hard palate. Then the middle part, which is kind of butterfly shaped in this area, and the posterior part, which is back here, and we'll go through that separately. The main features of the anterior part, we got the teeth, the hard palate, alveolar processes for the teeth, the palatine processes of the maxilla anteriorly, and the horizontal plates of each palatine bone posteriorly. Then we have the middle, which is super complex, and it's separated by the anterior half and the posterior half. In the anterior half, you have the vomer at the midline, right here, resting on the sphenoid bone, and it forms the nasal septum. Then you have the sphenoid bone, which is centrally placed in the body, and it's paired with the greater and lesser, and the wings projecting laterally from the body, right in here. Two downward projecting pterygoid processes in there as well. Let's see. The posterior half of this, it has the base of the skull, occipital bone, and parietal temporal bones. This area we'll go into a little more depth, but in another slide we'll kind of look at it from another view. Let's see. In the posterior part, you have the base of the skull, you have the big old foramen magnum, and you have the portions of the occipital bone that we went through on the previous slide. So just be very familiar with all the different parts on the skull. I can't go through each one of them, but try to give you a little overview of that. Here it kind of correlates with it. Those are the different foramen and what goes through them, and so that way you can kind of put those things together and it all makes sense. Alright, when we talk about the cranial cavity, this is the inside of the skull. This is the top portion, so if you took the cap off of the skull, this is what we would see. There's not a whole lot going on here, but we'll go through it pretty quickly. This is basically the roof, the dome-shaped area that projects superiorly and covers the brain. Mainly it's comprised of the frontal, parietal, and occipital portions. Underneath here you can also see where things would fall, so you can see the groove for the middle meningeal artery. You can see these other grooves in there. You can see the sagittal suture from the other side, and the groove for the superior sagittal sinus. And then you also have these separate grooves for the middle meningeal artery, which is what we talked about when we talked about the pterion. Let's see, in here there's also the little holes that communicate with the outside of the skull. And that's about it. Okay, so when we think about the internal cranial base, so now we're looking at it where the brain was sitting when it was sitting in the cranium. Again, we can break those up into anterior, middle, and posterior sections. And those are laid out here: anterior, middle, posterior. We'll go through each one of them individually. Alright, so this is the anterior cranial fossa. What's important in here? Well, we have a couple of foramen that we want to know. Remember, anytime we look at a piece of the skull, we want to know what foramen we see. We have the foramen cecum, which is where the emissary veins can connect with the nasal cavity, as well as the olfactory foramen, which are these little foramen in here that form the cribriform plate, and this is right where the olfactory nerves sit to help us smell. The parts of the anterior cranial fossa are made up of the frontal, the ethmoid, and sphenoid bones. And there's, like we said, the cribriform plate, the foramen cecum, the anterior and posterior ethmoidal foramen, and the anterior posterior ethmoidal nerves and arteries and veins that will sit in this area. And this is above the nasal cavity and the orbits, and it's filled by the frontal lobes and cerebral hemispheres of the brain. Anteriorly, the frontal crest projects from the frontal bone, right here. This is the point of attachment for the falx cerebri, which we saw when we took the skull cap off of our clients in the lab. This is the area that separates the hemispheres of the brain. Then immediately posterior to the frontal crest is the foramen cecum, like we talked about. This may transmit the emissary veins connecting with the nasal cavity and the superior sagittal sinus. When we were talking about the danger zone of the face, this is what was mentioned in lab, and we can go over that later in clinical correlation. Posterior to the frontal crest, you have the prominent wedge of bone, the crista galli, right here. And that is also the attachment for the falx cerebri. There's another point of attachment for the falx cerebri is a vertical extension of the dura mater separating the two cerebral hemispheres. So lateral to the crista galli is the cribriform plate and the ethmoid bone, which is right here. We already talked about that a little bit. This is a sieve-like structure, kind of like a when you can think of a strainer, where you drain your pasta, so it has lots of little holes in there. It allows the small olfactory nerve fibers to pass through so that we can smell. Alright, then we look at the middle cranial fossa. So this is the butterfly-shaped like area in the floor of the cranium. It consists of the sphenoid and temporal bones. The boundary between the anterior, middle, and middle cranial fossa and the midline is the midline between the anterior edge of the chiasmatic sulcus, right here, which is the smooth groove that stretches between the optic canals. The posterior boundaries of the middle cranial fossa are formed by the anterior surface as a high superior border, the petrous part of the pteromastoid part of the temporal bone, as well as the greater wing of the sphenoid houses the foramen rotundum and foramen ovale, which are important foramen that we need to know what goes through there. So when we think about the optic canal, which is right up here, you think about the optic nerve, the ophthalmic artery, central artery, and the vein of the retina. When we get to the superior orbital fissure, which is right in here, we think of a lot of things that pass through it: oculomotor, trochlear nerve, abducens nerve, the ophthalmic division of the trigeminal nerve, and the ophthalmic veins that pass through there. Then the foramen rotundum. The foramen rotundum is important because the maxillary division of the trigeminal nerve goes through there. The foramen rotundum is located right here. Then we have the foramen ovale, oval-shaped hole. The mandibular portion of the trigeminal nerve goes through there, as well as the accessory meningeal artery, and occasionally the lesser petrosal nerve will travel through here as well. The foramen spinosum, which is right here, that is where the middle meningeal artery goes up from up into the cranium. Then you have the foramen lacerum, which is right in here. And nothing really passes through this foramen. I know I said most foramen things pass through, but the upper part is traversed by the internal carotid artery and a greater deep petrosal nerves en route to the pterygoid canal. And then we have the carotid canal. Let's see. The carotid canal, here's the opening of it right in here. And this is where the internal carotid artery and the sympathetic nerves travel. And you have the Then we have the hiatus for the greater petrosal nerve, and we have the sella turcica, which is in here, right? This whole area forms the sella turcica, which is kind of like a saddle-like area of this part of the fossa. So that's basically it. This one's kind of complicated. Like I said, we have the superior orbital fissure, optic canal, foramen rotundum, foramen ovale, foramen spinosum, foramen lacerum. We have the carotid canal, and then we have the greater petrosal nerve. So now we go into the posterior cranial fossa, which is the consisting mostly of the temporal and occipital bones, and small contributions from the sphenoid and parietal bones. It's the largest and deepest of the three cranial fossa, and it contains the brainstem, which includes the midbrain, pons, and medulla, as well as the cerebellum. So when we're looking at the different structures here, we can see that there's the anterior boundaries that form the dorsum sella and the clavus. This is the clavus is that slope of the bone that extends upward from the foramen magnum, and it's formed by contributions from the body of the sphenoid and from the basilar part of the occipital bone. Laterally, the anterior boundaries of the posterior cranial fossa are the superior border of the petrous part of the pteromastoid part of the temporal bone, so right here. And then posteriorly, the squamous part of the occipital bone to the level of the transverse groove is the major boundary. Okay. Then we look at the different meatus and foramen. So we can see there's the internal auditory meatus, which is where the facial and vestibulocochlear nerves and labyrinthe artery go through. Then we have the jugular foramen, which is where the glossopharyngeal, vagus, spinal accessory nerves and beginning of the internal jugular vein go through. We have the hypoglossal canal, which is where the hypoglossal nerve and meningeal artery go through. And the foramen magnum, which is where the spinal cord and the spinal accessory nerve, vertebral arteries, venous plexus. So a lot of things go through it. It's a big hole. That pretty much covers this. So let's get into here. We have, this is a good overview of everything, and I like how it lists out where the different cranial nerves and things that pass through these different holes. I think this is a good one. So we have number 1, cribriform plate. We've already covered it. This is where the olfactory nerve runs through. So number 1. Number 2, we have the optic canal. Optic canal here, optic nerve goes through there, right? Then we have another hole right here, the superior orbital fissure, which passes, several things pass through here. We have number 3, we have that's oculomotor nerve. We have number 4, trochlear nerve, the first portion of the 5th cranial nerve, which is the ophthalmic division of trigeminal, and then we have 6 abducens. They all go through the superior orbital fissure. Then we have the V2, or the second branch of the 5th cranial nerve, which is the, everybody know? Huh? It's the maxillary division, right? That travels through the foramen rotundum. Then we have the foramen ovale, which is right here, and the third portion of the trigeminal nerve, or the mandibular division, travels through the foramen ovale. Then we have cranial nerves 7 and 8, and those go through the internal acoustic meatus, right here. Oh, and over here, what that popped up said standing room only, so you can think of the V1, V2, and V3. So, standing room, which is the rotundum, and only, which is ovale, SRO. Help us remember which branches go through which holes. Moving on, we got, again, the 7 and 8 go through the internal acoustic meatus, then 9, 10, and 11 go through the jugular foramen back here, and then the number 12, and 11 also goes through the foramen magnum, and then number 12 goes through the hypoglossal canal. It's a hypoglossal nerve, which makes it easy. This is a money slide, people. Y'all need to know this and where they go through, because this is super testable material and it's important to know. Alright, not going to go through this in a whole bunch of detail. This is basically the underside of the skull, and again we can note which structures come out of which foramen in this area as well. Alright, so clinical correlation. It's super important that you know how to correlate this clinically. If we don't know how to correlate this anatomy clinically, then why are we learning it? Really, none of your patients are going to come in and give you a quiz on cranial anatomy. What they're going to do is present to you with certain things, and you're going to have to figure out how what they're telling you is related to the anatomy, and how the anatomy helps you figure out what's wrong with them. There's several blue boxes in your anatomy text. I don't want to go through all of them specifically. There's a lot of different little disease processes and things that we can correlate with the anatomy, but I think it's pretty straightforward and easy to understand, so I'm going to let you go through it. What I am going to hold you responsible for is knowing all of the information in the blue boxes. This is anatomy, it's not clinical medicine, so I am going to ask anatomy type questions, but you do need to know how they correlate clinically, please. Almost done, bear with me. This is in regard to the medical imaging of the head. So back in the day, radiographs, pretty much what they used to get were just plain x-rays of the skull, but nowadays, we have all this fancy technology. A lot of days, we come into the ER or go into the primary doctor, we're getting CT scans, which give us 3D renditions of the skull and allow us to really see a skull and internal structures, and allow us to really see what's going on very quickly. MRIs are also used. They're used particularly for determining completeness of vasculature, and that's necessary in some surgeries. They also have ultrasonography, which allows us to work up for strokes. We do Doppler studies, which help us detect if there's any type of clot or stenosis forming in the carotid arteries, which can help us predict or prevent strokes. So those are just a couple things about the imaging of the head. Again, we already touched on this. One of the other important clinical correlations that I found with this was the pterion and how it can cause, skull fractures can cause injury to the middle meningeal artery and then cause epidural bleeds, which can lead to death. There's some other fractures, the depressed skull fractures. So you see like this, people that are hit with blunt objects can get these depressed skull fractures. And what's dangerous about that is that the bony fragment that's depressed is pushing into certain structures on the brain. You can get primary brain injury from these type of fractures, as well as hematoma formation. Let's see. That's about all I have on this slide here. And that's pretty much the overview of the skull. Like I said, there's a lot in each part of the head anatomy that needs to be looked through. I just wanted to go in a little more detail because when we get into class time, there's no way I'm going to have the amount of time to go through detail like this. So hopefully this helps you. Hopefully I didn't bore you to sleep. It is hard to teach anatomy because it's so many names and structures that really just have to be memorized. But if you can take away anything from this integrity lecture that I've given you, is knowing the different divisions, the different bones, the different sutures, and then what travels through the different foramen, what they're called.
And this will help us when we get to the cranial nerve section of our lectures. I want to thank you for listening in today, and I'll see you in the next lecture.